My name's McKenzie. I'm a Soma yoga therapist, which is a particular school and style of yoga therapy that blends classic applications of yoga with something called somatic exercises or somatic movement. And so it's a little bit of a hybrid approach, which is unique. So I work with clients on that. I'm also a TRE provider. Here at Redbeard, I see clients one-on-one for therapy. Beyond that, I also do small group series, workshops, and weekly classes that help to support the work that I do with clients on an individual basis. So my studies are with a school called the International Institute of Soma Yoga. And Soma Yoga blends the work of someone named Thomas Hanna, who was actually a student of a gentleman named Moshe Feldenkrais. And Thomas Hanna's work really helps us to re-educate our systems. It helps us to explore the way that we hold tension and stress in our bodies, either because of habitual patterns, maybe also because of traumatic patterning that came about from either an accident or a surgery or some sort of injury or an emotional holding pattern. So through somatics, we get to explore those patterns and also teach our nervous systems how to unwind or release those patterns. So that work strongly informs the way that I approach yoga therapy. So in addition to that kind of movement practice, I do also weave in some classic yogic practices, sometimes using yoga asana, definitely using breath practices. I also introduce people to something called dinacharya, which are daily practices or routines around self-care and creating a routine that's going to support overall health and well-being. And then the last piece that I bring in, which is a little bit unique to me, is that I will often introduce clients to TRE as well. And so with some of my clients, we're actually creating a hybrid of classic asana, somatics, and TRE. Some clients we might work with one of those modalities more clearly or specifically, but I allow all three of those to have a place in the room when I work with clients. So yoga therapy relies on a few traditional models, one of which is called the koshas. And the koshas are a model of our experience of self, the experience of me, Ellen, and how I might experience the many layers of that, right? It recognizes that there's a physical body, but that model of the koshas recognize that there's also many other more subtle layers to us that we can experience. Some of those subtle layers we may get sort of cut off from because of dysfunction or lack of integration in other places. So for example, there's the layer of the body, there's also a layer of what we would call breath or energy, and the mind. Those are the three most superficial layers. And then within that, there's even sort of this understanding of wisdom or intuition, and then our experience of awe in the world, right? A connection to something greater than our concrete self. And so when I'm working with someone therapeutically, we might spend some time working on that body layer, particularly if they're coming in for low back pain, right? And maybe our sessions start by being very specifically somatically or movement oriented to look at the tension pattern. But what happens very often is that the client starts to recognize that underneath that tension pattern, there may also be something going on in their breath, right? And there may also be something going on in their emotions or in their feelings that's related to that. And so when we start to look at those other layers, that's when we're really starting to step into the realm of this is yoga therapy, rather than looking at our body as this distinct thing that is not informed by these other subtle layers of our being. So it's truly this holistic approach. So someone might come for somatics and we can absolutely stay in that realm and really focus in on that. It would essentially be more of a physical therapy of sorts. But the beauty is that we're not limited to that we can go deeper if that's a place that the client wants to go. So Thomas Hanna is the founder of somatics, and his work is a branch off of his original studies with Feldenkrais. The thing that distinguishes his work is that he really, through his studies of the nervous system at the University of Florida, his studies there helped him to understand the way that our nervous systems normalize patterns of tension, and that normalization can be even to the point at which we're no longer aware that we're even holding the tension, right? Like I might not even be able to feel that my shoulders are elevated because I've been doing this for 8 hours. That normalization process and then inability to feel the tension, he calls that sensory motor amnesia. And so his work is to really re-educate the nervous system to help it learn how to feel that in fact it is holding that tension, and then through the exercises, through the somatic exercises, also learn that it has the option to not be in that place of tension. And so it's really about re-educating our bodies and our nervous system so that we have the widest range of choices available to us in how we move and engage with our worlds. And his work really brought that forward in a way that identified some specific ways that we hold tension in our bodies and introduced a particular technique called pandiculation, which is the educational tool that we use for how to teach bodies how to get out of that tension. So my typical clients actually range quite a bit. It could be someone who's in their 20s, recovering from an injury or a chronic use situation. I actually work with a lot of graduate students because of the stress and the many, many hours spent at a desk, whether it's researching or doing intensive work. So that's been a population that I've worked with a lot. But from there, it can really cover the gamut all the way up to folks that are looking to, age in a healthy and vibrant way. And so looking for work to help them maintain functional movement so that they can be independent for as many years as possible. But I would say, generally, I work a lot with folks that are dealing with chronic conditions, whether it's chronic pain. Maybe there's a history of arthritis and joint degeneration, and so they're looking to be kind of in negotiation with that and how they can maintain, an active or fulfilling life even with X, Y, or Z condition. But I've also got other folks that are coming in not for anything body related at all. There's been a certain stress or traumatic experience in their life, and they're really looking for some other ways to help them engage with that experience and to help them kind of both integrate it and grow from it and move on from it. So with each of my clients that I work with, after each session that we have, and each session will be a little bit different, you'll get a take-home program. And that home program will be something that evolves and constantly changes as we learn more about the situation, the symptoms, what's working, what's not working. And so it's that home program is always a work in progress. But we'll work together to develop that, because one of the clear intents with this work is that I want my clients to be empowered in their own body rather than dependent on me. So I almost always start with a new client by saying something along the lines of, I don't want to see you for the rest of your life. I want you to know how to take care of you. I'm here for support. We'll see each other more intensely for a period of time, but over time, you'll start to develop the tools that you need so that you don't need to be in this office as regularly. And that home program is part of the way that we move them towards independence, right? And that's a really important thing that I like to clarify with my clients. Independence is important. So one of the other modalities that I work with is TRE, or tension and trauma releasing exercises. And that is a body of work that comes from a gentleman named Dr. David Berceli, who's the founder and creator of that work. And it's a body-based trauma therapy where through a series of exercises and some held movement, we induce what's called neurogenic tremoring. And neurogenic tremoring is a shaking or a trembling that occurs in the body. It's also a type of shaking or trembling that's available in all mammals. And our bodies in our normal life, if we didn't have sort of our human conditioning of shaking is crazy or scary, if we didn't have that sort of conditioning, we might be shaking quite a bit because it's the body's natural way of regulating and discharging the tension of stress, tension, and trauma. But in part because our human conditioning invites us, the story, the narrative invites us to shut it down, to not do it. What we do in TRE is we induce it on purpose to kind of harness the therapeutic value of it to help us regulate our nervous system. And so we use this for folks as kind of a self-care thing for someone who just feels like they have stress. But we also use it in the treatment of things like PTSD, complex trauma, and a number of other things. One of the most important things that I'm doing is giving my client permission to be an expert in their own body and experience. That they are in the inside of this. And because of that, will have information I will never have access to. They have a felt sense of their body, their experience, their emotions. And that is hugely important information. And so if there's a way that we can bring that forward, and then for me, if the client can bring that forward and I can support them in bringing that forward, that then can help and actually inform me in the decisions that I make and the direction that we might go. And so often I'm really just following the wisdom of my client and giving them permission and empowering them to really be this expert in their own body and to run experiments for themselves, to be curious, because through that curiosity, through that experimenting, they're going to continue to develop a deeper and more nuanced understanding of themselves, whether it's on the body level, whether it's on the breath level, mind, so on and so forth. And the more nuanced their map of themselves is, the freer they are, the more that they're living from their fullest potential. It's all there. Everything they have, they need is right there. And my job is just to help facilitate the unearthing of that wisdom that's already within them. So my husband is an arborist, and so used to climb trees for a living. And over many years of active lifestyle, he's also a weightlifter. He had a chronic injury to the long head of his biceps and actually ended up having to have it surgically cut. So having that cut changed, the functionality of that shoulder. And also there was some nerve damage and some scar tissue that, was a result both of the surgery, but just also from the chronic injury. And after that surgery and having the arm immobilized for some period of time, there was a lot of ramifications that went beyond just the shoulder. And he had some atrophy of muscles in his chest and his pec specifically, and some things that were just, feeling for him dysfunctional and unstable. So through the work, for him, it was specifically somatics that felt like the most powerful tool. But now he's got a much more stable shoulder, and he's able to do a lot of the things, like, for instance, opening a door handle was a particular thing that was difficult for him, where it would feel unstable, and that's no longer the case. And as a weightlifter, for him, he's thrilled because his right pec now turns on, which is like a huge win for him and a huge priority. So I always joke that he's like my greatest marketer because he just has been so happy with the new kind of functionality and stability that he has in that joint, even though he still has, the long head of his bicep is no longer there. So he's got this functionality and stability with the reality of the new structure that he's dealing with. So thank you for the opportunity to speak about my work and my passion. For all new clients, I offer a 30-minute free consult. So if you would be interested in setting one up and learning a little bit more about what this work can do for you, you can email admin@redbeardbodywork.com, and I will help you get that arranged. I look forward to meeting you soon.